Hi there, I hope you're all keeping well. Welcome to my fourth video blog. I thought I'd jump straight into DIY dentistry. Some of you probably read a little bit in the press about people pulling out their own teeth, putting in various filling materials into their teeth, using super glue, etc. Now, I'd strongly recommend not doing this. Pulling out your teeth, you might leave bits of tooth behind, which can cause worse infections. Also, the implement that you're using might not be clean, so that could cause an infection as well. Also, using other types of filling material, or for example, using things like super glue, can cause irreversible damage to teeth, which means that we'll end up having to take them out rather than trying to save them, which we may have been able to. So the key thing is, as I've mentioned in most of my other video blogs, is please give me a call. Telephone numbers below. And we can have a chat, discuss the options and go from there. If needed, we can now refer you to an urgent dental centre. There are one or two in the area. Well, there's one, I believe, in the Reading area, there's one in Winchester area, but you have to be referred by a dentist. So you have to contact me first, and then we'll go through the various options. And then if it's deemed appropriate, as a last resort generally, then we can refer you to one of these urgent dental centres. So please don't hesitate to contact me. The other thing a lot of patients are doing, or some of my patients are doing, is that they send me pictures, which is great. So you can send me a number of pictures, one from a bit further away, so you can see most of your face and your teeth, one close up, and the other one as close up as you can get to your teeth, depending on how good your camera is. And that can give me amazing amounts of information, even if it's just to reassure you and say, well, actually, that doesn't look too bad. And we can keep an eye on it, keep it clean, etc. What I'm also doing is I have for a few weeks now I have some temporary filling kits. Now these aren't kits that you can buy from, for example, Boots. It's actually a specific dental material that come in sealed pots that actually dentists use as temporary filling materials as well. And I can get that to you if you do, for example, lose a filling and need to fill the hole up as a temporary measure. They're quite straightforward to use, and I'll obviously give you instructions how to use it, but it's very straightforward. Also, if you have a really sort of significant infection, for example, swelling that isn't settling, painkillers aren't controlling it, you're getting a fever, then I can get some antibiotics to you. We keep them in-house, we follow all procedures and protocols that are needed, and we can actually get that delivered to you. So I can pop around and I can deliver that to your house. So that's no problem either. The main thing is that you obviously give us a call and we'll be able to have a chat about it, and I'll be able to offer some advice. Things like Zoom conferencing and video conferencing will probably be the part of the future of dentistry as we move forward. So we can sort of limit face-to-face contact to a certain degree and limit the spread of any potential virus, any potential infection. Things like whitening consultations, some cosmetic consultations, maybe implant consultations, where basically most of it will be about having a chat, question and answers, asking me things that you want to know about in dentistry. So things that we don't necessarily have to have, face-to-face contact where I need to be looking in the mouth. There are a lot of things, however, where you will need to come into the surgery. We might need to take x-rays. We may need to have a closer look at the tooth, etc. And obviously all treatment we have to do in the chair. I think that's quite obvious. So in summary, no DIY dentistry. Please, please, please don't do any DIY dentistry. Give me a call. I'm here for you anytime you need to. My mobile phone number's on 24/7, and just give me a call and we'll have a chat and we'll go from there. I'll be in touch soon. I'll do another video blog, but we're hopefully going to get back to some sort of normality, hopefully in the next few weeks or so. I'm obviously planning and trying to get things ready to get back going as soon as possible. And look forward to seeing you all very soon. Take care. Bye-bye.